Hello friends, in this video we will delve into what a stroke is and why it is considered a serious health issue that can affect people of all ages. I'm Incredible Health Science, and today we're going to thoroughly examine strokes. A stroke occurs when there is a decrease or interruption in blood flow to the brain, resulting in damage to brain tissue. This happens when the brain is deprived of oxygen and nutrients, causing brain cells to rapidly die. Strokes can occur suddenly and lead to serious consequences. Strokes can affect individuals of all ages, and interesting findings emerge when we examine the age distribution. Traditionally, strokes were thought to primarily affect elderly individuals. However, there has been an observed increase in stroke occurrences among young people in recent times. What could be behind this increase? Factors such as stress, poor dietary habits, low levels of physical activity, and other lifestyle choices can contribute to an increased risk of stroke in young individuals. Sadly, stroke cases are on the rise among the younger population, reminding us of the importance of a healthy lifestyle. Understanding the effects of strokes and the associated risk factors can help people of all ages protect themselves from this serious health issue. In this video, we will provide more information about the symptoms, risk factors, and preventive measures related to strokes. If you're looking for important information about strokes, you've come to the right place. Before we begin the video, don't forget to subscribe and like and join me on this journey. Now let's delve deeper into understanding strokes and examine the top 10 signs to watch out for before it happens. What is a stroke? The term silent stroke is commonly associated with transient ischemic attack, TIA, also known as silent ischemic strokes or silent stroke attacks. TIA refers to temporary symptoms resulting from a temporary decrease or interruption in blood flow to the brain. TIA symptoms typically last from a few minutes to a few hours but do not persist beyond 24 hours. These terms have the following meanings. Silent symptoms. In some cases of TIA, patients may not notice or understand their symptoms. Patients are often unaware of neurological symptoms, hence they are referred to as silent. Manifest stroke. Some individuals experiencing a stroke, cerebrovascular accident, may have prominent symptoms such as loss of movement, speech impairment, or other noticeable symptoms. What are the types of stroke? Stroke is a condition that occurs when blood flow to the brain is reduced or interrupted, resulting in damage to brain tissue. The types of stroke vary depending on the cause of the blood flow disruption and which part of the brain is affected. Here are the common types of stroke. Ischemic stroke. This type of stroke occurs when blood flow to the brain is blocked. It is the most common type of stroke, accounting for approximately 80–85% of all strokes. Subtypes of ischemic stroke include thrombotic stroke, caused by a clot, thrombus, forming in an artery in the brain due to plaque buildup or narrowing. Embolic stroke, caused by an embolus, a clot that breaks loose, traveling to the brain and blocking a blood vessel. Hemorrhagic stroke. This type of stroke occurs due to bleeding in the brain. It happens when a blood vessel in the brain bursts or leaks. Subtypes of hemorrhagic stroke include intracerebral hemorrhage. Bleeding occurs within the brain tissue from a ruptured blood vessel. Subarachnoid hemorrhage. Bleeding occurs in the space between the brain and the thin tissues covering it, subarachnoid space. Transient ischemic attack, TIA, also known as a mini-stroke or silent stroke, is caused by a temporary decrease in blood supply to part of the brain, resulting in temporary symptoms that typically last from a few minutes to a few hours and resolve within 24 hours. TIA is often considered a warning sign and may indicate a higher risk of a more severe stroke. These are the main types of strokes, each with its own causes and implications for treatment and recovery. Early recognition and appropriate medical intervention are crucial for minimizing the damage caused by stroke. What are the mini-stroke signals? The term mini-stroke typically refers to a condition known as a transient ischemic attack, TIA. TIA is characterized by temporary symptoms resulting from a temporary decrease or interruption in blood flow to the brain. TA occurs due to a temporary blockage or narrowing of a brain artery and usually leads to symptoms that last from a few minutes to a few hours. TIA symptoms typically do not persist beyond 24 hours. Symptoms of TIA can differ from those of a full stroke. TIA symptoms may include sudden temporary weakness or numbness in one arm or leg, sudden temporary speech impairment or difficulty understanding speech, sudden temporary loss of vision or double vision, sudden temporary loss of balance or dizziness. TIA is often considered a precursor to a more serious stroke and is regarded as a warning sign. Early diagnosis and treatment are important for individuals experiencing TIA because conditions leading to TIA often increase the risk of a more severe stroke. It's crucial to seek immediate medical attention if TIA symptoms are experienced. Therefore, the term mini-stroke is commonly used to describe TIA and is considered an indicator of a serious health issue. Unknown silent signs of stroke. Certainly, here is the list of 10 signs that can be recognized before a stroke occurs, translated into English. Facial asymmetry, expression with one side of the face drooping or appearing uneven when trying to smile or frown. Arm or leg weakness, sudden weakness or paralysis in the arm or leg. Difficulty lifting the arm or moving the leg normally. Speech impairment, sudden difficulty speaking or understanding speech. Speech may be unclear or jumbled. Sudden headache, severe and sudden headache that is not related to any other known cause. Vision problems, sudden loss of vision or blurred vision in one or both eyes. Loss of balance or coordination, sudden loss of balance, dizziness, or difficulty coordinating movements. Difficulty walking or maintaining balance. Numbness or tingling in the face, abnormal sensation of numbness or tingling on one side of the face. Sudden fatigue or weakness, extreme tiredness, weakness, or loss of energy that occurs suddenly. Sudden diarrhea or vomiting. In some stroke cases, digestive system symptoms may occur suddenly, including severe diarrhea or vomiting, loss of consciousness, or sudden fainting. In some cases, stroke may lead to loss of consciousness or sudden fainting. If you notice any of these symptoms, it is important to call for emergency assistance immediately and seek medical attention at the nearest healthcare facility. Early detection of stroke increases the chance for effective treatment and intervention, helping to prevent serious consequences. Don't forget to subscribe to my channel and turn on notifications to stay updated with our new videos. I'll be delighted to see you on my channel. Best wishes.